Good evening, everyone. Welcome to the Haverhill Journal Live for Monday, January 25th, 2021. I'm Lindsay Paris, here with you tonight from the HC Media Studio. Tonight, pool testing for COVID-19 has begun in the Haverhill Public Schools. We're going to learn more about this innovative test method from Katie Vozeolas, HPS Director of Health and Nursing Services, and how vaccines may affect back to school. After, we'll visit Northern Essex Community College to see how the school's art gallery has moved online during the pandemic. But first, Mayor Jim Fiorentini is joining us for his latest update. Mayor Fiorentini, thanks for joining us.
Well, for our senior citizens, it's an exciting moment. The governor announced today that phase 2 of the vaccine rollout plan starts on Monday, this coming Monday, February 1st. So those of you that are 75 and older, starting Monday, you'll be eligible to get the first dose of the vaccine. You can't get it from the city, not yet. We are going to set up public distribution. But what you need to do is call your doctor starting Wednesday, Thursday, or Friday, and your doctor will have some sign-up list. Now, you need to be patient. The doctors can't see thousands of patients all at once on one day. The phase lasts between February and April, but I want every one of you who's 75 and older to call your doctor or email them, or just watch for an email from them. They'll email you and sign up with your doctor. We're also looking to CVS and Walgreens. We'll have some further announcements about that, about whether or not they're going to have any clinics. I'm hoping that PMA and Greater Lawrence Family Health will have some also. We'll have further announcements about this. Right now, though, 75 and older. The second group of simultaneously will be people who have 2 or more what are called comorbidities, underlying medical conditions, diabetes and heart disease, being obese and having cancer. 2 or more comorbidities. Having a smoking habit is considered a comorbidity. Obesity is a comorbidity. If you have 2 or more underlying conditions, you're also eligible to receive the vaccine, and you need to check with your local physician about that. Watch the City of Haverhill page. We're going to have a special page on vaccines. And as we get more information from the state, it changes on a daily basis. We will update you. And I'll be back next week to update you further. But for 75 and older, it's an exciting time.
Mayor Fiorentini, thanks so much for being here tonight.
Thank you so much.
Stay up to date with the mayor by subscribing to his blog at jimfiorentini.wordpress.com or by reading his updates on the Haverhill News page on Facebook. Students at the Haverhill Public Schools have resumed 2-day-a-week in-school instruction in the hybrid model, which began last week for Cohort C, this week for K-8 Cohorts A and B, and next week for Haverhill High School. The return to school has been accompanied by a new COVID-19 pool testing effort. HBS Director of Health and Nursing Services, Katie Vozeolas, is joining us to discuss the effort and how it's helping keep kids learning in person. Hi, Katie. Thanks for coming on the show.
Thank you for having me.
So pool testing, what is it? Explain it to us.
So pool testing is a testing mechanism that allows us to test greater numbers of individuals with all the samples in one pool or one tube for really a surveillance model. It is cost effective, and it allows us to really to identify perhaps asymptomatic cases in the school. Times when an individual may be positive and not know they are positive. So we can create pools and do that testing, and then if the pool is positive, and then we do individual testing to identify who the positive is.
How many children are included in each pool?
So the vendor that we are working with allows us to have between 5 and 25 samples per tube. We are right now focusing more on kind of the 5 to 10 per tube. And typically with pool testing in a school setting or a setting of this type, you would have the pool be, say, the classroom. So it would be the teacher and the paraprofessional and 8 students, for example. Or, it might be a sports team. So samples or pools would in many cases be pooled together based on who they were with, rather than saying all the teachers would be in the pool or all children with the letter A were in a pool. A lot of times you do it by the logistics of where they sit most of the day.
No, that makes perfect sense. And so say if your student was in the classroom and they had consent, so how would that work? Would you have a nurse come into the classroom and administer the test to all the students at the same time, or how does that go?
Sure, that's a really really great question. And we're finding it's unfolding in a little bit different ways depending on the settings and the number of people testing. So yes, a nurse, or we have some health assistants who are working with us on this program, either invites whoever has their consent in place down to a location where they're doing testing, or goes to the classroom or just outside the classroom. And again, as the program builds, most likely it would be in the classroom. And what we would do is there would be sort of a confidential location in that classroom where somebody could actually swab, and in most cases children swab themselves and adults swab themselves. They're taught how to do that. It's very easy. And so if the testing team would go into the classroom and they would invite up one at a time the individuals to be tested, so there'd only be one person unmasked or their nose unmasked at a time.
Okay, so and teachers and staff members are tested at the same time as students?
That's correct.
Okay, and is that true also for like staff members who are not in the classroom, say cafeteria workers, custodians?
Sure. And so again, our pools, as we ramp up the program right now, can be fairly mixed. But yes, in every building this week, the nurses are working with all the different people who support our children in learning, and they're all invited to participate. So custodial services, we do test transportation kind of as a group just because logistically that works. Our facilities groups, City Hall. So we're really doing it for all staff and students. It's available to everybody. And, I think our goal would be to try to test weekly, have that available for people weekly. But again, it is a pilot, and we're going to see how that goes.
Right. No, I think having the testing, it really puts parents and students and teachers at ease, that we do know who has it, who's asymptomatic, and what's happening. Now, I understand the vaccination process. Now, teachers, I believe, are part of Massachusetts Phase 2.
That's correct.
So have teachers begun receiving vaccinations yet? Do you have any idea when that may be?
Sure. So Phase 2 begins February 1st. So the teachers under the essential worker educator or educational institution umbrella have not started to be vaccinated per the phased schedule that our governor has put in place. And they're actually kind of the step 2 of Phase 2 is that group. People with 2 comorbids, I believe, conditions are the first group in that. But we are right now behind the scenes working to build out what would be our opportunities for vaccination for our staff. And I suspect there might be more than one option. And so we have some individuals who are working on that, and we're working with some of our partners, certainly Mary Connolly, our wonderful public health nurse, but some other community partners. So at this point, the vaccine is only available for adults or youth age 16 and up if it's a Pfizer vaccine, or 18 and up if it's a Moderna vaccine. So at this point, our focus is on, again, trying to get the programming together for the adults in our buildings.
Right, absolutely. Now, do you believe that might be something that could theoretically be administered at a central location for Haverhill schools instead of a teacher having to go out to, an outside facility to get the vaccine, if that might be organized by the actual public schools department?
Sure. Again, I think every community's kind of looking at what their resources are and what the best plan is for that community. And there's a team that includes one of our nurses or several of our nurses, Shannon's also on that team, that are looking at what's our best option for our schools. So we could potentially have a vendor that would come in and administer it in school. Or again, as I say, there might be some other options. I think it's important to remember with the COVID vaccine that this is a little bit different than the flu vaccine, where somebody walks through, we can do, a whole, 20, 30 people in no time on the flu vaccine. In this case, individuals must be monitored for at least 15 minutes, if not 30 minutes post-vaccine. Wow. And they also have to have committed to basically the date and time of their second dose in 4 weeks if it's Moderna or 3 weeks for the Pfizer. So it is a little more time consuming. So it's going to take a little bit more planning and makes it harder to sort of mass vaccinate all at one time.
Right. And I know that some parents have been saying already, when are we going to be able to get our students vaccinated? As you just mentioned, the Pfizer vaccine only available to 16 and up and Moderna to 18 and up, so that might be an issue. But do you foresee there being a child vaccine at some point in the next few months?
I hope so. Yeah, I mean, I think we're all hopeful that that will come along and that they'll be able to work through the appropriate approvals and FDA approvals, and for the students to get it, that would really be our optimal situation to have all of our educators and support staff vaccinated, or the majority, and then the students. And then when we get to that herd immunity, that gets us closer to being back toward something that looks like what normal school might look like.
Perfect. And one more question for you, back to the pool testing. So is the pool testing expected to continue throughout the remainder of the school year? Or?
Sure. Yes, I believe as long as we do not have the majority of our students and staff vaccinated, that we will most likely be doing pool testing. Again, as I mentioned, this is a pilot right now. The Department of Education has now sort of jumped on board and created some piloting programming for pool testing to help support schools. So we're ahead of the curve. So thank you, Dr. Murata. But I do believe we'll continue that probably for the spring.
Wonderful. Katie, thank you so much for coming on the show.
You're
and for
welcome.
sharing
Nice to
all
be
this
here.
important information, and also for all that you've done for the department in keeping our kids safe and healthy.
Thank you so much for having me.
Thank you so much. The Journal recently met with Northern Essex Community College art professor and gallery coordinator Mark Mannheimer downtown at the Switchboard to talk about his move of this year's NECC Linda Hummel Shea Art Gallery shows into an online format, and how local artists have joined together to keep inspiring art accessible to the community.
Hi, I'm Mark Mannheimer. I'm a professor at Northern Essex Community College and gallery coordinator for the Linda Hummel Shea Art Space. And because of the pandemic, we're online. And I felt it was really important to move the gallery online because it's an educational gallery. It's meant to be a community gallery where people from the Haverhill community and Merrimack Valley, and of course both campuses of Northern Essex, can come and see really good professional work. The current show is the work of Rob Santagata, who's an artist from Lowell. Really very provocative, interesting work. A number of the works were done as in a response, not necessarily a direct response to the pandemic, but because the pandemic is happening, the work is related to that. The next show, which will be up next week, it'll probably be up on the 24th or the 25th, is the work of William Short, who's a photographer based in California. And the work that we're going to be showing for that show is, I believe it's called A Vision of Red America. Bill comes from Ohio, and he went back to the county in Ohio where he grew up, which is predominantly red, if we're thinking about political terms, and focused on what life was like there now compared to what it was like when he was growing up many years ago. And they're really interesting, beautiful works. Where I am right now, I'm in the Switchboard Gallery space on Washington Street in Haverhill. There's a few works behind me, and that show will be online also, the Switchboard Gallery's online site. For all of you who, like me, enjoy going to galleries and museums all the time, here's an opportunity to really experience really good work at Northern Essex site as well as the Switchboard site. But take advantage of it every week. Go online, sit down in your living room or wherever you are and enjoy the artwork. And thank you.
The current show at the NECC Hummel Shea Gallery is New or Worsening Conditions by Rob Santagata. Upcoming shows include My Red America by William Short in February and Untitled by Patrick Jacob, featuring prints and sculptures in March and April. And that's our show for Monday, January 25th. Thanks so much for joining us. Watch the Haverhill Journal live again at 5:30 and 9:30 p.m. every weekday night on Channel 22. And as always, keep watching HC Media for up-to-date information, series programs, public service announcements, and more. I'm Lindsay Paris. Good night.